very good and very useful to know and to convey to our clinical colleagues. Another major event is work done by Tom Giordano at the University of Michigan and Dr. Getz, and working with a large group of individuals, endocrinologists, many pathologists, have shown very elegantly in this publication in Cell a few months ago that the entire major genetic findings of tall cells have been elucidated, and so one can use this knowledge to really probe the molecular genetics and possible coming up with other treatment for more aggressive variants of this papillary thyroid carcinoma. The final case is that of a 63-year-old woman who presented with a 3-centimeter right thyroid mass. She had, at the time of workup, this was done at the Mayo Clinic, there was a 1 centimeter long nodule that was present during this workup. She had a total thyroidectomy and selective right cervical lymph node resection. The tumor was positive for TTF1, P53, which were some of the markers we did later on in working up this series of cases, as well as thyroglobulin. And then we also, in the recent workup, found a BRAF V600E mutation in the lesion. Here is the histologic appearance of this, in which one has cells that are follicular variant of papillary thyroid carcinoma on this side, and then these are other cells in which one has cells that are obviously have larger nuclei, as you'll see later on, other features that suggest that they may be more aggressive, but suggestions here of the hobnail pattern to some of the tumor cells. A higher view showing the hobnail pattern, accentuating this within the tumor cells. Another higher view showing that the cells have large nuclei, prominent nucleoli, and even mitotic activity. As many of you know, it's rather uncommon to see very many mitotic figures in usual papillary thyroid carcinoma. And another view accentuating the hobnail pattern, reminiscent of tumors that one sees in ovarian clear cell carcinomas and a few others with these hobnail features. The tumor had metastasized in the lung, and here it was in the bronchial wall in the case, showing nests of tumor cells, very unusual for the typical or usual papillary thyroid carcinoma. And within the lymph node, one sees again the hobnail pattern, but also a micropapillary pattern that's somewhat reminiscent of tumors that one sees in the lung, in the breast, in the bladder, and other sites. And as we know, these are usually more aggressive from a lot of data in the literature. When we stained this tumor along with the series that were studied, TTF1 was positive, so we could exclude that possibility of an anaplastic cancer, because as we know, anaplastic cancers are usually negative for TTF1 as such. So this is a moderately differentiated tumor that's papillary, but also expresses TTF1. And surprisingly, the tumor cells express P53 with the nuclear staining. Again, it's usually highly aggressive thyroid cancers, anaplastic cancers that are expressing P53, but in this case, this moderately differentiated tumor was positive. We haven't sequenced the TP53 gene to know if there are specific mutations, but certainly that's something that can be done in the near future. So the diagnosis is that of a papillary thyroid carcinoma hobnail variant. Follow-up was that the patient died of disease with metastatic hobnail variant of papillary thyroid carcinoma to the lungs, short 31 months after the original surgery. As most of you know, it's pretty unusual to have patients with papillary thyroid carcinoma dying of their disease. We had an index case of this tumor in 2004, seen at the Mayo Clinic, sent in as a consultation. The the tumor behaved fairly aggressively. We had made the diagnosis of moderately differentiated papillary carcinoma, sent it back to the pathologist who sent the case, and he sent us another biopsy of the liver a few months later saying, "Are you sure that's a papillary thyroid carcinoma? This patient has liver metastases and other sites that are suspicious of metastatic disease, and this isn't typical for papillary carcinoma." And in this case, the patient died of disease 6 months after diagnosis. But we had worked up the case fairly extensively, so we were pretty sure of our diagnosis, and the liver tumor showed the same. And here are different fields showing that prominent hobnail pattern of the tumor. So we had several options in looking at approaching this tumor. It was a new entity that we had observed, and we could report it as a tumor as a case report. But usually if one's a resident or a fellow, there was certainly one's encouraged to do this. But if one's really been in the field for many years, the other option, of course, would be to wait until you get many of these cases. But it's a very rare tumor, so that may take a long time, even at Mayo Clinic. And then the third option was to really go through the files at the Mayo Clinic and see if we recognize other cases of this hobnail variant. Mayo Clinic, as you know, one can go through the files and go back to the time when the Mayo brothers were operating and come out with cases and blocks, tissues that are well preserved for 50, 60, or even longer periods of time within those very precious files. So we did that when a pathologist came to visit from Italy. Dr. Sofia Azzioli came to spend 8 months with us at the Mayo Clinic, and she was a very outstanding pathologist with a great eye for histopathology, and went through many, many thousands of cases, files, and came up with some other cases. We had 2 in consultation and 6 others, and we reported this just a few years ago in the American Journal of Surgical Pathology, with a very long title to that article, but appropriately descriptive. And so one had cases of these lesions, and there were 8 patients. As you can see, many of the patients were in their 60s or 70s, but even one patient was only 28 years of age. There were mainly T3 lesions as such, but there were some smaller tumors. And surprisingly, many of the patients, 4 of the patients died of their disease, with an excellent follow-up that's available at the Mayo Clinic, and a couple were alive with disease, metastatic disease. BRAF mutation V600E was present in at least 4 of the cases out of 7 that were analyzed. So it's similar to the tall cell, in which one has a higher propensity to have BRAF mutation. So we, at that time, had also defined these cases as 30% to really call it a hobnail variant of papillary thyroid carcinoma. So the second question we had in terms of having cases with 5% or 10% hobnail variant was, does one really need that high percentage to really consider these tumors to be more aggressive? So that Dr. Azzioli did this by looking at the cases at Mayo, and then when she went back to Turin, pulled out cases from her file, over 1,000 cases, and we came up with about 0.6% of cases that would have this hobnail pattern out of all the papillary thyroid carcinomas that could be examined. And patients commonly presented with a neck mass and cervical lymphadenopathy. And when we looked at these with Kaplan-Meier analysis, one can see that the hobnail variant patients did poorly, even as with the 8 cases, but there are also cases in which there's 10% of tall cell or hobnail, and the patients, some of these patients did go on to die of their disease. At this time, we were using the term of hobnail as well as micropapillary. But the term micropapillary is somewhat confusing because we know that there's papillary microcarcinoma, which is a fairly common small tumor, less than 1 centimeter or less in size. And so we are using the term hobnail variant as a consistent pattern for these lesions. After this report, there have been several other reports validating the existence of this lesion. This was the original report by Dr. Azzioli from her group, and then with a larger series, many of these patients went on to die of disease or had distant metastases. A series from Mexico in which 7 cases were examined with predominantly micropapillary pattern, as several of these patients again succumbing to the disease. A series from Mass General, published in Thyroid a few months ago, again has tumors with distant metastases and 1 patient dying. And a series from WashU with 6 cases, again showing the fairly aggressive nature that the tumor has these morphologic features. So what are some of the reasons that one may have these more aggressive behavior in this Hobnail variant of papillary thyroid carcinoma? 3 possibilities can be suggested right off. 1, the loss of polarity with altered glycoproteins such as MUC1 may promote metastases, and we know this has been associated in other cancer models. Epithelial to mesenchymal transition, or EMT, with decreased expression of E-cadherin, increased expression of some transcription factors such as stale and slug, can also be associated with more aggressive tumors. Even though this is a somewhat controversial concept, there's a tremendous amount of data in the literature supporting the EMT concept. And of course, genetic mutations, we're showing the BRAF mutation, but possibly also TP53 mutation would be another factor that would contribute towards these more aggressive variant. We have some evidence that the second possibility is one of the things that's occurring in these patients. In an article we published some months ago in the American Journal of Pathology, we showed that PRRX1, which is a newly described transcription factor that's a good marker for EMT, is highly expressed in anaplastic thyroid cancers and in some Hobnail variants of papillary thyroid carcinomas. We did not see this marker being expressed either by immunohistochemistry or Western blots in even the tall cell variant, which is a little less aggressive than this variant of papillary thyroid carcinoma. Another thing that one can do in recognizing the Hobnail variant, and this was reported by Dr. Azioli in a study of 5 cases retrospectively in the Cytology Journal, and there are 2 other reports in the literature as well in recognizing these Hobnail variants, is to recognize first that it's a papillary thyroid carcinoma. Then the nuclei have these peculiar, in some cases, teardrop pattern that can be useful in suggesting the diagnosis. And in this close-up, one can see in the cell block that Hobnail pattern of the lesion, and then cytologic features of papillary carcinoma, as my cytology friends tell me, including the pseudo-inclusion here in this lesion. So we've come a long way in looking at papillary thyroid carcinoma. The conventional or usual papillary thyroid carcinoma that one can recognize very readily with all the diagnostic, cytologic, and histologic features, with the orphan nuclei that's been well described in the literature, to a large series of tumors that really fall in this general framework of papillary thyroid carcinoma. This is just a limited list, but one has the conventional or usual papillary microcarcinoma, follicular variant, tall cell, columnar cell, etc., including the Hobnail variant. And this is just a partial list of the cases. So, as in most areas of pathology, even the simple papillary thyroid carcinoma is becoming a more complicated entity to diagnose with all the variants that one sees. So in summary, the highlight points that I'm trying to make is that use of monoclonal antibody to chromogranin A, and one particular one that's widely used, LK2H10, this has contributed really greatly to the increased diagnostics precision in surgical pathology in recognizing neuroendocrine cells as well as neuroendocrine tumors. The tall cell morphology, and that shows the elegance and beauty of our morphologic observations in diagnostic pathology. One can look at these tumors and recognize that it's tall cell even before you do immunohistochemical or molecular analyses and make the diagnosis of these lesions and predict that they're going to be more aggressive. And the final point is that this Hobnail, which is a relatively new variant that's been described just a few years ago, appears to be an aggressive variant of papillary thyroid carcinoma, which I think should be recognized by general surgical pathologists. And even cytology may be of some help in some of these cases of these rare tumors. And my final slide is really personal.